everyone. This is Michelle Grimolia, the President and CEO here at Woodland Pond. And today is November 30th, 2021. And this is my noontime address on a Tuesday. So first and foremost, I would like everyone that's listening right now that is planning to come down and get your Moderna booster to probably wait in your apartment or cottage for about another hour or so. So we've got plenty of chairs ready for you, and lots of neighbors are down here waiting. So you've got time. You don't need to rush down. The vaccinators will be here until they're done. So if you want to wait more comfortably, just wait in your apartment or cottage and come down around 1 o'clock or so. If you'd like to try it sooner, you're more than welcome. And we've got lots of seats. So bring a book or a crossword puzzle, your insurance cards, your vaccination cards, and we will get you situated. So things are cooking right along, and we should get everybody boosted today that would like to get boosted. So that's the first order of business for today. I see lots of activity going on campus today. I would like to say a big thank you to all of the residents that are in the lobby right now, spreading some holiday joy, decorating the lobby, and I love seeing the tree up. So I think that's fantastic. The news of the week, of course, is that COVID cases are up sort of around the area. And this weekend, Ulster County Executive Pat Ryan did declare a state of emergency here in Ulster County, which activated a number of things here on campus. So I'd like to just talk a little bit about that. I'd also like to just confirm that we do have 2 positive staff members that do have symptoms of COVID and did test positive. Both do work in our dining program, although neither of them are wait staff or dietary aides. One works in the kitchen and one does some administrative and other tasks, but all of the staff are together. So the way that we're looking at all of our interactions together is that everyone is around everyone. Of course, we're all masked and we're all vaccinated, but we are around each other. We're in a residential setting. So even if this person didn't necessarily wait on you, they may have worked in the kitchen with someone that then did go wait on you. So we have to treat this with caution. There's no doubt that COVID is, present and can certainly become activated in people that are vaccinated. So it's just super, super important at this point to wear your masks all the time, safely distance, avoid up close personal contact with people if you are unmasked, unless you live in the same household. Wash your hands, avoid unnecessary trips into the public. If you need to go to the grocery store, rather than going twice a week, wait and then just go once a week, those kinds of things. I have had some concerning reports of some of you letting me know that you're seeing your neighbors at Tops or other places in town, and that you're not wearing your masks. Now, of course, wearing your masks off campus is totally optional, but I would strongly, strongly recommend, with the cases where they are and the fact that every resident here is considered to be at risk, that whenever you're in public at this point in time, that you are masked, and avoiding personal contact and so forth. So we'll see how this goes. We are going to continue to communicate everything with you and just kind of go through each day as it comes. So where we are on campus right now is that because of the state of emergency, certain things got activated in the health center. This is completely separate than the 2 positive cases. And I just want to make sure that that's clear to everyone. So because the skilled nursing facility and adult care facility are regulated separately than the rest of the community, each have their own set of regulations. And for each, we have to comply. Otherwise, we can be cited for being non-compliant. So currently, New York State has an order that states that if a local jurisdiction or the state of New York issues a state of emergency related to COVID, that visitation in adult care facilities, which is our assisted living, or in the skilled nursing environment, drop down to just 2 what are called compassionate caregivers per resident. So those are 2 people that no matter what's going on during that state of emergency, they will always be able to visit you in the health center. So you will always get those 2 visitors, whoever you have named. However, if in the event of a state of emergency, which we are currently in, it is just those 2 people that can visit. So I'd like to be clear that the limitation on visitation in the health center that's going on right now, again, has nothing to do with the positive cases in independent living. This is because of the state of emergency that was declared by County Executive Pat Ryan. So if and when that lifts, or if and when the state changes the regulation, we may be able to increase the number of visitors. But for right now, it's just those 2 compassionate caregivers is what the state calls them. And we will let them in and to visit you as much as they would like to. Separately and aside, we, of course, as a community, have to decide what we're going to do when we have a positive case on campus, or in this case, 2 among staff members. So because the risk is central right now to our dining program, and because dining is an unmasked high-risk activity, we made the decision to, for just a week, 1 week, close the dining rooms so that we can make sure that that one single high-risk unmasked activity is not a perpetrator of a spread of COVID. So right now, the only thing that is truly closed is the dining room in the community building, the pub, and then the dining rooms in the health center. Everything else is open for business in independent living. It's just you need to be masked for all of your activities this week. We need to social distance, and we need to not come out if we are symptomatic or not feeling well. In the health center, other than the dining rooms being closed, the only thing that is on pause right now is, again, congregate group activity. And right now that's related to the executive order, the state of emergency. So rest assured, everything is going on as scheduled. It's just must be masked. We are not providing refreshments at meetings and so forth right now, because you cannot eat and drink and be masked at the same time. So our plan is to watch all of the numbers, make sure everybody's feeling well through the end of the day Sunday. And then if that is, everything is in order, then we plan to resume certainly the main dining room being reopened, the pub being reopened, and so forth. So not to fret, we are hearing it loud and clear that no one wants things canceled. That's what we're trying to do, is keep things from being canceled. But certainly wearing a mask is prudent. I got my booster last week. I wear a mask everywhere I go now. It's not my favorite thing, but if it's the difference between me being able to spend Christmas with my family or not, then I will definitely wear a mask and get a booster. So that's where we are today. I would like to just welcome any questions that any of you have. I will be in the office all week this week. I am also always available on email. So I didn't have much else to share today. What I'm going to do is I'm going to say goodbye, because I'm going to go help in the vaccine clinic and just get people, there's paperwork through and everything. So I'll look forward to saying hi to everybody as they wait for their boosters today, and I will see you on campus this week. Thank you.